Hi, it's Jody from Everyday Nothings again. I am now leaving my consent visit at my surgeon's office. So I'll tell you a little bit what happened, but just know that every doctor's office is different. And then even between patients, like, depending on where your BMI is, you'll be on a pre-op diet longer or shorter amount of time than I was in that. So follow your doctor's instructions, okay? But I know a lot of you are watching these videos like I have been doing for the past year and a half to get an idea of what's going to happen and what goes on. So here's my story. They call it a consent visit because you sign your papers consenting to the surgery at this visit, but a lot of other stuff goes on too. So first thing that happens, medical assistant just takes my vitals, normal stuff. And then they took me back to a room. Physician's assistant then comes up and actually does like just a really quick exam. You listen to my heart, listen to my breathing, feels my abdomen just to check. Make sure it talks to me about pre-op care, like if there are any medications that I needed to stop taking before the surgery. For me, there aren't any other than no ibuprofen a week before. And then post-op instructions, she goes over the prescriptions they're going to give me for nausea. They give prescriptions for nausea, cramping, and pain. So it's actually 4 different prescriptions total. So I'll just take those to the pharmacy and get those filled before my surgery. And then the dietitian comes in and goes over the pre-op diet and the post-op diet. I'm on a 2-week pre-op. Actually, it comes in like 13 days because my surgery is 14 days from today. And I won't really start until tomorrow because it's almost dinner time now. So like over half the day is already over. So now if I had an early morning appointment, it would probably be starting today, if that makes sense. So, and then they actually want you to use their food. So I purchased the food. To give you a rough idea, mine was roughly $200 for 2 full weeks, but it's everything you eat. So, I mean, that's probably right about or maybe less than what I spend on groceries just for myself. Or eating, especially eating out. So I didn't think that was bad at all. Excuse me. So got that, and they actually give you the food. So I got that, and then I had to go. The medical building that they're in has a lab in the same building, so I went to the lab and they took some blood work. That was all the pre-op testing I needed. I did not need an EKG or an endoscopy or any other further labs. Oh, endoscopy! Sorry, I forgot to tell you guys. I got my biopsy results back from my endoscopy with my colonoscopy back when, and it's clear for everything, and I am calling it a praise Jesus answered prayer. My doctor was absolutely certain that there was something really seriously wrong with my stomach when he saw the level of inflammation and the number of ulcers that were in there. He basically all but told me I had Crohn's disease. It was just, we're waiting for the results. But yeah, you've got it. It was kind of the thing. So, all this time we've been preparing for it to be Crohn's, and then we've been praying for the way that I word my prayers is complete healing of my GI tract. And I didn't tell a lot of people because I didn't want people to freak out that I had, Crohn's or whatever, before we knew for sure. But I know, like my mom, I told her, and people have been praying. Biopsy results came back. They did multiple biopsies in my esophagus, stomach, and duodenum, and every one of them came back clean. No Crohn's anywhere, no signs of cancer anywhere. Something else they were checking for, bacterial infection, H. pylori bacteria. There's a list of 7 or 8 things, none of them good, that they were checking for. None of them even minor bad. They were all pretty serious things that they were checking for. And it came back negative for everything. It was basically, we have no idea why your GI tract looked so horrible. Please keep taking the medication. They give some medication to help with the inflammation. So please keep taking the medication. We'll see you in 4 months and see how you're doing. So praise Jesus, praise the Lord. I'm taking that as an answered prayer to have someone who, my gastroenterologist is pretty well respected in his field. He's older, not insulting or anything, but older. He means he's more experienced. So that is an answered prayer, and we are praising the Lord for that answers. And they don't know why my stomach was so bad. on your personal medical history, or maybe even your family medical history, your doctor may want further testing. So my doctor only wanted blood work. So that's all I had to do. So I did that today, and then they had me actually go. So where I've been going is the medical office, but again, located in the same building as the surgery center. So I went to the surgery center and filled out some paperwork there, paid my balance. Ouch. That was painful. And that was it. The blood work that I had done was not fasting. I said something in the other video about like alcohol fasting, and it wasn't. So it was good. The one thing that she told me, just to make all of you aware, because they wanted to make me aware as a patient, is they said the number one complaint they get post-surgery is the patients that aren't drinking enough, and it's because you don't feel like drinking. You don't feel like eating or drinking, which you're not eating, but it's clear liquids, but feel full. I'm not hungry. I don't want to eat. I don't want to drink. And they talked about how important it is to keep your hydration up, and they have a little plan where you do diluted fruit juice at certain times during the day to help keep your sugar at an even keel, so that your blood sugar doesn't plummet, which I think is really smart. And I was worried about, I tend to actually run hypoglycemic. I tend to have low blood sugar, so I've been concerned about that post-surgery. So anyway, so they talk about that, and she just stressed the importance of, you have to do this. You won't want to. You will feel full, even though you haven't had anything in forever. You have to drink your water. And they have it in, I think it was 2 ounces every 20 minutes or something. It's a really small amount, which is just to keep it going, keep your body hydrated. They really want me to focus on trying to hydrate prior to the surgery, so you're not starting out. She's like, of course you'd be on IV fluids during the surgery, but if you're already starting out well hydrated, that's just going to help you even more. So drink is basically the key. So that was probably my biggest takeaway that I didn't already know. I am having mine done at a outpatient surgery center. So one of the questions that I asked, just to help put my mind at ease, is if the God forbid happens, the little bit God forbid this happens, where is the nearest hospital? Where do they take you? In the God forbid that you are that like 1/10 of 1%, or I don't know, whatever it is. But oh my gosh, we have to go to the hospital. So I asked that question. If you're having yours done in an outpatient, I would highly recommend you get that be one of your questions. So what do they do? In the God forbid that you are that person, what do they do? Where do they take you? What's their procedure? And if they don't have one, find a new surgeon. All I gotta say. And that's for any outpatient procedure you may ever have. There can be complications anywhere. I used to work for a dermatologist. We had complications once with someone having just a fairly simple skin cancer removal. We did hundreds of them all the time. Inpatient, no big deal. But he was an older patient. His blood pressure dropped, and we had to ambulance him to the nearest hospital. So it doesn't matter what you're having. It can be a very minor procedure. You think nothing of it. Please always check. What is your plan? Only God forbid that there is a complication. What do they do? And if they do not have a plan, find a new doctor. That's my advice to you. So anyway, I guess that's about it. Please, if you have any questions, I'm right at the beginning of this journey, but if you have any questions, please feel free to comment them below. Again, if you have your own YouTube or your own blog, things, I need to get my social media posted. I don't think I have it on there yet. I need to check. I've said before, I'm kind of new with the YouTube thing, still figuring it out, but I need to do that for you guys. My blog is everydaynothings.com, just like it sounds. I don't blog as often as I like, but